Take precautions to prevent heart attack and stroke. Your blood vessels need training. Circulatory strain sleeve-based restricted flow. In a nutshell, monotonous blasts might be worthwhile to one's well-being. To keep oxygen-rich blood from arriving at the cells in the heart or cerebrum, coagulation or development of plaque in a course causes most coronary episodes and strokes universally. Tissues die when blocked for a long time. Yet, a rising number of studies recommend that concise, rehashed times of diminished course utilizing a circulatory strain sleeve might assist with limiting tissue harm and keep away from the most exceedingly terrible results of respiratory failures and strokes, like how practicing assists muscles with adjusting to additional thorough exercises. As per the exploration, the direct, painless medical procedure might further develop heart and vascular capability, marginally decline pulse, and diminish the responsibility of the heart. In a new survey concentrate on that was distributed in the Journal of Physiology, James Lang, an associate teacher of kinesiology at Iowa State University, gathered the consequences of around 100 examinations, some of which were his own. That's what he said. Distant ischemic preconditioning, RIPC, commonly involves 5 minutes of high strain on an individual's arm trailed by 5 minutes of unwinding, rehashed 3 to multiple times. Filling the hole. In any case, Lang noticed significantly more exploration is expected to guarantee that RIPC is viable in various settings and for different populace subgroups. Creature models from the 1980s and 1990s give most of the information on the fundamental systems and length of defensive impacts. Sadly, a ton of scientists bounced rapidly to huge clinical examinations in the mid-2000s, and their outcomes were conflicting because of a large group of outside impacts like the members' prescriptions, physical and hereditary factors, age, and sex, said Lang, adding a subsequent report from different specialists found propofol, a typical type of sedation utilized in medical procedures, stifles the impacts of RIPC-To. Since then, scientists like Lang have been attempting to bridge the gap between extensive clinical trials and animal research. In the lab, we can conduct more controlled experiments with human subjects to try and determine what influences RIPC and when the optimal moment is to deliver RIPC, said the researcher. Lang's lab. In one review, Lang and his examination group found 7 days of RIPC expanded members' miniature circulatory limit by as much as half. In another, they estimated an unobtrusive pulse drop and a less dynamic, survival, reaction while the members were resting. One of the manners in which Lang tests the impact of RIPC is by estimating the way that review members' veins enlarge when their skin is warm. Lang made sense of a deficiency of vein flexibility, $#, that is what I means $#. The degree to which supply routes can choke or expand, builds the gamble of hypertension, coronary episodes, and strokes, as well as dementia. Right now, Lang is working with a scientist at Des Moines University to concentrate on how RIPC could assist individuals with diabetes battling with slow-mending wounds. High blood glucose levels can harm little veins and nerves, and coat conduits with plaque, making it harder to get white platelets and supplements to cuts and wounds. Although RIPC has very few negative effects, Lang advises anyone considering using it on their own, outside of a research project, to speak with their doctor first. Watch for more informative videos. Please subscribe and like our YouTube channel Brighter Health Info. Also visit our website www.brighterhealthinfo.com and press the bell icon.